If your dog has been diagnosed with epilepsy, you've probably heard about medications like phenobarbital, levetiracetam, which is Keppra, potassium bromide, and maybe even zonisamide. But there's another option you may not have heard about yet. Imepitoin. I think I'm saying that right, but I could be wrong. Or it's more commonly recognized by its brand name Pexion. In this video, we're going to take a look at this medication, not as commonly known for canine epilepsy, what it is, how it works, why you might not have heard about it yet, and whether or not it might be a good fit for your dog. Welcome back to Learn with Ruby. I'm Mandy and my dog Ruby has epilepsy. This channel is all about sharing what I've learned over the last 8 years of caring for Ruby to help you feel confident and supported while caring for your dog with epilepsy. So what is Imepitoin? Imepitoin, marketed as Pexion, is a veterinarian drug developed specifically for dogs. It's not a human drug being repurposed like phenobarbital or Keppra. It was designed specifically with dogs in mind. So it was first approved in Europe for the treatment of idiopathic epilepsy. So that's epilepsy without a known structural or metabolic cause. This is what Ruby and most dogs with canine epilepsy are diagnosed with. Unlike many other canine seizure medications that are human drugs used off-label for dogs, Imepitoin was designed from the start as a veterinarian-specific treatment. Here's where it gets confusing. While Pexion has been used in Europe for canine epilepsy since 2013, it's not FDA approved in the United States for seizure control in dogs. Instead, the FDA approved it in 2019 for the treatment of noise aversion, and it's sometimes prescribed for anxiety-related conditions. However, many U.S. veterinarians can and do use it off-label to treat seizures, especially when it fits the specific needs of the dog. In simple terms, Imepitoin enhances the calming effect of GABA, an inhibitory neurotransmitter that helps reduce excessive electrical activity in the brain. Imepitoin works by calming the electrical activity, which helps reduce the likelihood of a seizure starting or spreading. Like all seizure medications, Pexion comes with side effects. The most common are sleepiness, wobbliness or lack of coordination, increased appetite, occasional vomiting or diarrhea. But most of these tend to show up early and fade as your dog adjusts to it. Clinical trials found that Pexion significantly reduced seizure frequency in many dogs, sometimes by 50% or more. But here's what I love about Pexion. Pexion doesn't fully control the seizures. It can be combined with other medications like phenobarbital. It's flexible, and what's great about that is that gives you options. It may not be the best fit alone for dogs with severe epilepsy or frequent clusters, but it may be used in these cases in combinations with other epilepsy medication. If you want to read more about this newer drug, check out the research section on my website, learnwithruby.com, and you will see I've started to build out the section for this medication. There are also 2 papers linked at the top that do overall comparisons between all of the seizure medications available, and you will see that Imepitoin does very well compared to some of the top medications that are more known. Pexion is prescription only and is a veterinarian medicine, so not for people. It needs to be dispensed through a veterinarian or an online pet pharmacy. Pexion might become the medication that vets start to reach for first, but it may not be right for every dog. It's an important option, especially for dogs with mild epilepsy. If your vet mentions Pexion or you've been wondering whether it's worth asking about, now hopefully you have a clearer view of this medication. If your dog is just starting the seizure journey, some things to think about are starting the seizure log. If you haven't started one already, check out the link to my seizure log in the description below. Watch for side effects the first few weeks and be able to communicate those to your vet. Ask about cost And if your dog takes any other medication, make sure that you've talked about if there are any interactions, especially anti-anxiety and sedatives. So one book that I wanted to share with you that I have gotten more recently, as I've been trying to really learn more about each of the medications, especially the medications that Ruby is on. I want to know the mechanisms, like how are they working? Why are they working? How do they work together potentially? And so I got this book here. It's called A Practical Guide to Seizure Disorders in Dogs and Cats. You don't need to get this. There is a lot of information that you can get online now. But if you wanted to dig deeper, sometimes it's nice to have just a book right there that you can grab. There's a whole section in here on medications, and it really does the deep dive into how they work, why they work. So this is something that I have more recently. It's quite a lift as far as the medical side of things and very technical. But they do a beautiful job at the end of every chapter, kind of making a nice summary of like what are the main points to take away from that chapter. And there's a whole chapter about medications in here, along with a lot of other really great information. So I just wanted to share, this is one of the newer resources that I really have been diving into little by little. So I will have a link to that in the description just in case you're interested. Otherwise, the internet is a great place to find a lot of the information if you want to have a deeper dive into how a medication works that maybe your dog is on. If you have found this video helpful, please like, subscribe, and share it with someone who needs this kind of information. Thanks for learning with me as I learn with Ruby.